I'm really happy to be here talking about a topic that I, as a reporter, have been working on for many, many years, how we collect data on ourselves and use new technologies to really make that happen. But before we really jump into it, I wanted to ask you all, I think you've been sitting here for a while this morning, to loosen up a little here. How many people here consider themselves quantified selfers? Okay, not as many as I would have thought. How many people would like to be? You don't even really know what that means potentially here. What we mean by quantified self is there's the movement and then there's the thing. And the thing is really all about taking both simple and complex new technologies and applying it to ourselves, mostly as healthy people. Sometimes, obviously, if you've got a condition, you might be monitoring that. But it's really tracking one's own health and using different technologies, websites, et cetera, apps, to try to see what you can learn about yourself. And in the bigger world, this is a movement coming from below that I think is connecting with something that's coming more from the top, or various sideways motions, where technology, where business, even elements, hopefully, in the government, we heard a little bit about that in the last panel, are beginning to converge around this movement upward from people that are interested in using technology to discover more about themselves. And so the panel here today, we're going to each give a couple remarks. I just gave mine, and I ask each of the panelists just to tell a little bit about themselves, and we'll jump into a discussion here. Because we're running slightly late, our session will go, it will be a little bit shorter, but we will certainly be around, I think all of us, and we can continue the conversation. And hopefully at the end we'll have a little bit of time for questions. So, Leslie?
So I got interested in the quantified self and trying to understand, really, from a global perspective, how to bring patients a sense of security and well-being by allowing them to participate in the healthcare process and feel cared for by the doctors that were charged with caring for them. And for me, that also meant bringing the best in American technology and implantable, wearable devices, internet capability, ubiquitous mobility and sensing to patients, not to give them an additional burden of having to track everything they eat or the calories they walk, but in a way to allow them to learn themselves and partner in their care versus a more paternalistic, let me tell you what to do, and to glue their care together. Because we have, I would argue, unlike the last panel, I guess a little bit, we have the best devices in the world, many of which were developed here, that represent the most rarefied, important achievements in American medicine. A device industry that is highly sophisticated, highly successful, employs thousands of people, is capable of quantifying patients from a wearable or implantable with very little input. We can deliver that in a mobile way and preserve the specialists and the technologies and the doctors who are the most trained and potentially our elite forces in American medicine. We can preserve all that. We just have to glue it together in these important ways, in multidisciplinary ways, and allow people to tell their healthcare stories and feel cared for and engage and leverage all those great experts across larger populations, not to create a more medieval primary care environment with a lesser trained doctor, but to bring all the best in the elite forces together and the best technology to patients. So that's sort of what we work on a daily basis.
Okay, at AgaMatrix, we kind of came at this, I guess we backed into the quantified self movement, and we really started off as a device company making glucose meters for people who have diabetes. And what we realized was that people weren't doing anything with those numbers. All of a sudden, you had people writing their glucose numbers in a physical paper logbook, taking it to the clinic and discussing it with the doctor. And we looked at this and we said, well, wait a minute, we come from a world of informatics where you have to take things off the paper and you have to put it into more of a software world where you can look at trends, you can look at statistics, you can look at how your behavior changes over time. And so at that point, we realized that at the same time, Apple was coming out with their iPhone and iPod Touch, and we said, okay, well, here's an amazing device that enables us to track our health very efficiently. So what we decided to do was actually take a standard glucose meter, miniaturize it, and actually be able to have it plug into an iPhone. And that way, you've taken out one intentional step of data logging. You can automatically get data from your blood sugar measurements, and that in effect, allows you to share the data. You can annotate it with what you've eaten, have you exercised, what time of day is it, and all of a sudden you're in this world where you start looking at how your body is changing over time. And that was just the first step. And then we realized as soon as we got into that, there's a whole world of people wanting to measure everything about themselves. So then you have the Fitbits of the world, you have the We Things of this world. All of a sudden, you know, just a medical measurement isn't as valuable as if you see what that is in context. So for example, let's say you're wearing the Zeo sleep monitor, and you look at your glucose measurements in the morning. Well, wouldn't that number be a lot more meaningful if you put it into context of I slept well, or I didn't sleep well, or I woke up 4 times during the night? So all of a sudden, the correlations and the data model around behavior is now enabled because you have all these pieces coming together in a very, very convenient and consumer-friendly format. And I think that's my take on quantified self comes to Main Street is you've got medical, you've got consumer, you got to put the two together, and a lot of that is regulatory principles, but a tremendous amount is design principles, because you can lead a horse to water, but you can't make it drink. And you can only do that if you have the right devices and the right solutions and the right human interface to enable that.
And in fact, we have an interesting, our two panelists here represent, in a sense, the clinic and the business world on how to make this, all of these new technologies work. And the topic here is about how we take this to Main Street. And let me just start out by asking both of you, I mean, you clinical perspective, business perspective, but also just as folks, how do we take a quantified self movement, which is mostly, I mean, we got to face it here, there are people who are very fascinated by this, even obsessed. I think that's probably a small number of people, really, in terms of the large population. QSers are willing to go out and spend the time and money. And if you go to QS meetings, which are now, there are chapters all over the world, probably any given week, there's got to be one, almost every night now. People are talking about sharing their obsessions. But how do we take this and make it real for Main Street, for real people?
For me, healthcare is low-hanging fruit in the sense that everybody has unmet needs in healthcare. Healthcare is an incredibly emotional story, your own healthcare story, that of your loved ones. Everyone wants to glue it all together. Everyone wants it to work better. So it seems relatively easy to come up with solutions that can do that. I think the risk, and we're already seeing some backlash in fitness, is that you can't just create the same fragmentation digitally that currently exists in healthcare with the same monetization streams, et cetera. So how do you create the application or the ubiquitous sensor that won't segregate medical care from the rest of Main Street's life, where your medical care, in the same sensor you may be using to game on, is the same sensor that you use to diagnose your heart arrhythmia, that of your dog, your child, or your parent. But that same application also tells the story of the rest of your life, or provides input and doesn't require a lot of work on your part. That's why we're so enamored with sensors, because they can just input passively that are worn on the body or in the body. So I think what you do is you meet some of these enormous number of unmet needs, but you try to do it a little bit holistically. And when you do it holistically, then the business models open up, because you can use these same sensors to create the monetization model in sports or something else, and then pull the medicine through more passively.
Should you have anything?
Yeah, and sort of my perspective on this is that there's a lot of opportunity to make devices and services and solutions, but ultimately you want to be able to make a business out of this, or else these technologies won't sustain in the marketplace. And so if you look at it, we came at it from a medical device perspective. And so we embrace the FDA because A, that's the space we're in, but so many times I meet entrepreneurs and new startups that say, hey, we have this app, we have this little thing. What do we have to do to get around the FDA? What do we have to do so we don't have to deal with them? Is this considered consumer enough? And I look at that and I say, what does consumer enough mean? And I get it. All the user interface and the user design experience, that's awesome. But from a business perspective, wouldn't it be awesome to have FDA clearance on your side as a strategic advantage? That's a pillar, that's a barrier to entry. So my advice to them is, largely, you're not thinking about this right. Embrace the FDA, become a medical device. You shouldn't be a software IT company trying to do medical. You should be a medical company trying to do software and IT, because you can leverage the infrastructure that's in place. Because I think somebody was saying that a lot of the informatics services are not really reimbursed. The payers aren't willing to pay that to that level today. But there's a whole world where payers are willing to pay, and that's if you're in a regulated medical space. So use that to your advantage, and then build awesome user interface services around that. So your kernel is medical, and then your main street is the user experience.
Yeah, exactly. I mean, it's interesting, writing stories about this space. Because you've got this convergence now happening between the IT world, the Health 2.0 world, and biology and science and medicine. And I walk into a lot of startups, and it's a room full of engineers. And they might be doing an app around diabetes or something. And I go, where are the biologists? Where are the scientists? And then sometimes you have the opposite experience. And so I think there's still a huge divide between these two worlds. But it is converging. And in fact, Leslie, you offer almost another element to that in the sense of trying to tie together the clinic and physicians. How close are we, if you take a main street of physicians, to getting them to buy into the idea of self-monitoring?
They're going to have to be pulled through just because physicians are very busy. And I think this is a patient-based consumer plan. Physicians will move with it. And one of the things we try to demonstrate to doctors in every application or sensor or solution that we come up with is this allows you to market your practice and increases your efficiency and your ability to be a good doctor. And doctors are so pleased to see that because they're working harder for less, and they have the patients. They're not the enemy in the system. They see themselves as the ultimate patient advocate, right? Whether that trust is there always or not. And for the patients, we try to make every solution completely work for the patients. For instance, Sridhar's company developed this incredibly elegant glucometer that fit into an iPhone. And so we said, okay, that's ingenious with a beautiful app, but if the market for that is juvenile diabetics, we went to the Cinematic Arts School, and in a competition that they sponsored, they developed a game on that called Vampire Rancher, which is kind of a Farmville blood farm that kids can build by testing their blood and engage their non-diabetic, and to enhance compliance and develop a patient-centric solution. And the back end of that goes back to the doc. But really, right. You've created now a community around it that's super engaging, hopefully.
Well, this is one of my kind of concerns, and even, I'd like to maybe talk about this a little bit more about how you make this user-friendly. And like I said, the average person probably is not going to, use a ZO or measure this or that in their lives. They have way too much going on, or they're just simply not that interested. But I envision a day, maybe many years in the future, when you might be wearing a panoply of sensors, and your house is all wired up and measuring various things. How far are we from a world like that? And is that the world you guys envision?
I think we're like 1 or 2 killer apps away from really accelerating it. And maybe that app is a sensor on Tom Brady in the Super Bowl and me comparing my heart rate, and then that'll accelerate cardiac diagnostics. I don't know, but it's probably a popular culture type of experience with sensing.
Well, let me throw out another question then. I like to talk about big data and the collection of data. Do we really know what to do with all this data at this point? I mean, there was an interesting article this morning in the New York Times. My colleague Gina Collado wrote a story about all the extra tests that are run. And she was talking a lot about medical tests once you have a condition. But it made me start to think about, in my experimental man project, I've collected 1,000 gigabytes of data on myself. Wrote a book about it, et cetera. I still haven't derived a lot of meaning out of that. So,
yeah. Yeah, but
when am I going to find out what the heck's going on with my own data?
Well, there's 2 parts to this that I'd like to address. One is what to do with the data, and the other is how to get the data. And we're approaching it from the how to get the data perspective, because we don't kid ourselves. We're not that smart. There's a lot of really smart people who know what to do with the data, but what we want to enable is get them the data, get them the best data, the most robust data, and the most representative data. Because once you have it, I fully believe that somebody will be able to figure out what to do with it. And so our part in this ecosystem is to be able to enable the most easy ways to acquire data. And as an example, some of the stuff that we've been playing around with internally, we've seen that if you compare things with what you've eaten and what you haven't eaten, and you can actually see trends. But these are just pilot little R&D projects that we're doing in-house just for our own entertainment. And we're seeing, wow, if you could do this on a massive scale, wouldn't the CDC love to have something like this? You can correlate, opening of fast food restaurants versus average glucose level in a particular community, and all of a sudden you can craft policies around that. And so I think it's definitely possible, but in order to actually make an effect, you need to actually pinpoint a problem, a pain point. is it a cardiac, is it a cardiac arrest situation, or is it obesity, or is it, is it hypertension? What is it? You need to pinpoint something and say that's what we're going to craft the model around. And the model will work if the data is representative and robust enough.
Yeah.
Yeah, I mean, I think it is a land grab, so who's ever out there thinking, you have to start collecting the data to know. And we collect tons. We have, I run a national research effort to collect wireless data daily from implanted devices in 240,000 patients. We have 24 million downloads. We're constantly studying and analyzing that data. Well, we've learned how to make device, program them better. Since they cost $30,000, learn how to make them more cost effective. They already were, but even more, to make them work for the patient, to partner with the patient. So we learned that. We recently announced an initiative to collect the heart rate of everybody in the world at least once. It's called Every Heartbeat. So that, I don't know what that is. I don't know what that's going to be, but we're going to start to build that digital platform of biometric data, and then you can imagine people continuing to tell their healthcare narrative over that and build that wireless story, which hopefully then you can predict malaria and violence against women and children and heart disease maybe with the same data set, right. If you get enough points. But I don't think we know. I mean, we suddenly, for the first time, we've been doing cardiac arrhythmia management for 20 years. For the first time, we can collect the heart rate wirelessly of everybody for 7 days. And we do about 200 of those a month. I'm picking up stuff I've never seen in my life, in my own career, and I don't, just that little segment, I don't know what to do with my clinic patients. Yeah. So it is a discovery process, but that's what makes it really interesting.
So do you think there's a period here where we just simply are going to focus on the data? Obviously, the technology is enabling that. And I think Mike Schneider, who was a geneticist at Stanford, said that at some point the genome, for instance, will be free. Mm-hmm. Right, doing a complete genome. The interpretome, however, as he described it, might cost $1 million.
Yeah.
And where are we in getting to the point where, are we even ready to ask that question yet? Are we still collecting the data?
Yeah, I mean, it is a land grab to collect the data, and the good news is it's cheap, right? It costs more digital space to watch Avatar than collect all the heartbeat of everybody in the world for 1 day. Yeah. So it's cheap, you can store it, and the winners, I think, though, will have the data. So.
Yeah, I think
that's the way real estate works, right?
Yeah. Well, if you look at what happened with the consumer internet, I mean, when Google and these guys started out, they had a vision and they started building. And as you gathered more information, you started discovering more applications for it. Google Flu Trends is a great example. Nobody would have predicted that back in the day. So I think where we are, we're not in the development stages. We're in the research phase. We don't know what's out there. And so the problem is, a lot of times when you bring investment into a new industry, they're looking for a little bit more certainty and a little bit more of a roadmap as to where you're going to go with that investment. And new technologies will only be effective if you can get the right technical folks and the right financial backers to actually align the incentives and get it out into the market. And what people have to realize is we're in the research phase. We don't know what's out there. So any investment here is going to be highly speculative. There will be a couple of tremendous winners, but we're not in that, quote, development stages. We don't know what it is to build. We just know that we have to go and get lots of data and then look for patterns. And if you adopt that mindset, and a lot of the more forward-thinking investment firms have done that, then that's the mindset to take, because we're so intent on getting a quick return, especially in the software space. You have to realize, 10 years is a quick return in the medical space. And so that's 5 startups. and you have to get over that, because that's just a reality of what we have to deal with in a regulated space, in a device space, a medical space, especially when you deal with the sensitive topics like an individual's health and information around, the privacy concerns around that themselves are something that will limit the free sharing of information. But at some point, the genome might be free, but you're going to have to pay somebody a lot of money just to unlock it and allow permission. And so that's where the industry is moving, both policy-wise and also financially. So.
Great. Do you have something to add?
I mean, I think it's all about boutique individualized care, and as much as the quantified self can represent that, I get really afraid when people talk about doctors ordering too many tests all the time. I think Gina Claude is an amazing reporter, but at the end of the day, you want your doctor to be your advocate. You want to get that test even if you're an outlier. Big data doesn't necessarily account for you. So, let's not get so quick to dumb down medicine into some massive model where you don't count, or your dad who's 85 falls out of the equation. You want to advocate. Your doctor has to be able to make that decision. And a lot of these models don't allow that. And that's highly objectionable to me, who's constantly trying to advocate for my patient. You want ultimate choice. So how to save cost and really utilize all this great technology to maintain that choice for people, which I think that some of this talk that is really getting lost.
Yes.
I mean, I want to be able to advocate for you no matter what your situation is. If you and I decide that's the right choice, if your coronary calcium score doesn't fall into where somebody thinks that should be paid for, yet your sister just died suddenly, and you're really worried, and this $2,000 angiogram is going to set your mind right and that of your family, you need to be able to get that. That's really important. Right. And insofar as we can continue to build out and make the case for individualized care with these technologies, we should, that's what we're trying to preserve here.
I was thinking more along the lines of creating this sort of haze of data. And I'm more interested in that story, Gina's story, in terms of, say, the extra tests you might take as a healthy person, and a lot of that was on the sick. But when you're creating literally thousands or tens of thousands of data points on someone, how do you make sense of that as a clinician? Or even in a business, and it's just, I think it's a hurdle that we're going to be dealing with, and that we will.
Yeah. And we have to collect clinical events and things to validate, to see what it means. What does it mean if you pick up this crazy arrhythmia in a healthy kid? Well, you need 8 million kids constantly inputting, and then figure out who died or who did well. Yeah. But the promise is that you save the sudden death on the playing field. You pick up stuff before it really.
Well, it's interesting that one thing I want to follow up on. Leslie and I were just talking before the panel. Big data inherently is a statistical approach to things. And then when you're treating as a doctor or physician, it's not a statistical approach, it's an individual data point. It's one person. So, I mean, I throw it out to you guys, if you guys, is some software brilliant entrepreneur out there can figure out how to map statistical models to individual outcomes, then that's a great opportunity, because big data and big analytics is all about, generalized trends and statistics. They're not talking about an individual outcome, like individual outlier. How do you treat that one person when you're looking at a model that's created statistically? There's got to be human intervention, there's got to be a human factor, there's got to be a person who sits there, like you're saying, if this is really important to you, I don't care about what the statistics say, this is what I think you should do. And how do you bridge those two types of thinking? And I think that's what we're struggling with as an industry, is people want these tools, but then the medical needs are something a little bit different.
Yeah, in fact, I write a lot about ecosystem challenges and who should really pay for that. The NIH spends about 4% of its $30 billion budget on translational medicine. And the rest of it's on basically sick care. And while that's important, I think you need to begin to balance that out a lot more, because some of these issues have to be dealt with at an ecosystem level. I mean, companies, even large ones, are going to have a hard time paying for that. But I want to take questions from the audience in just a second, but I wanted to ask both of you, do you guys measure anything? Are you quantified selfers?
I do not
to put you on the spot.
No, I do. I do not have diabetes, but yet I probably test more than more than anyone else with diabetes. I test myself all the time with my own products. I also I weigh myself. I've lost 8 pounds in the last 2 months, thanks to Lose It. And I still have another 8 to go because I'm trying to train for a half marathon. So now I'm measuring, I use Runkeeper, I measure my pace, I measure, I plot all these things out and say, okay, what am I doing, what's working, what isn't working? And my next on my list is actually to get like the Nike Fuel Band or something like that. I have a Fitbit, but I forget to wear it.
So we're sucking you in.
You absolutely are.
Bit by bit.
Because I've seen the results. As soon as I start plotting things, I can see the trends, and it motivates me. I say, oh wow, I actually didn't have that Taco Bell thing last night, and I actually am a couple of pounds lighter, and it works. And that feedback is great. I mean, Taco Bell is I don't advocate for it, but it is really good sometimes.
Leslie?
Yeah, I do a lot of it. I walk around with so many sensors. I find that I'm diagnosing this stuff all the time. Like I'll go to the tennis court, it'll be on me, and then somebody goes down and oh, you have AFib, you're going 210. I mean, I'm walking around all the time with my glucometers, and suddenly I'm finding myself like, doing all this treating on the court or wherever I am, which is really fascinating. Wow. I've been able to find a lot of things with myself. I do it some. I try to wear the glucose monitors and the other things it's humbling, The work of being a patient is pretty. Just to try to identify with that a little bit.
So you've heard about this effort to make a sort of tricorder. So you've got a very primitive version of that, at least for one aspect.
Yeah, I mean, the tricorders that are coming out of this X Prize, I've seen some of the technology. They're just fantastic, Diagnose pharyngitis in your kid in 2 minutes. Figure out if you have to go to a doctor. It's great stuff.
Yeah, it's interesting. So I think with that, unfortunately, we're going to have to end here, and we'll be around if you have more questions, and try some quantified self. Thank you very much.
Thank you guys. Great panel. Thank you.